Hello everyone, welcome back to the channel. Here's medical terminology. The book that I'm reviewing information from is The Language of Medicine 12th edition, Chapter 15, Part 1. There are 3 parts to this series, so make sure you like and subscribe to get alerts and keep your studying organized. Let's jump right in. The musculoskeletal system includes bones, muscles, tendons, ligaments, joints, and cartilage. It provides structure, stability, and movement to the body. It protects our organs and even helps regulate minerals. It's a complex system, but you'll know so much more about it when you finish this video. Here's what you'll learn in this video. Medical terms that will help you understand the structure of the musculoskeletal system, and then we'll move into bones. How bones are formed, the types of bones, anatomy of a bone, and the science behind bone repair. For muscles, you'll learn about the 3 types of muscles, muscle strain, and various types of muscle movement. Finally, as wrap-up, you'll learn more related terminology and pathology related to this system. Let's start with the vocabulary that you'll need to know. Osteo means bone. Related examples include periosteum, a fibrous sheath that covers bones. It contains the blood vessels and nerves that provide nourishment and sensation to the bone. Osteoblast forms new bone tissue by producing and secreting osteoid, a protein-rich matrix that mineralizes into bone. Osteocyte. Osteocytes are mature bone cells that reside within the mineralized bone matrix. Osteoclast dissolves and breaks down old, damaged bone cells. They make space for osteoblasts to create new bone tissue in areas that are growing or need repair. The images show the progressive life of the bone cell. Myelo means bone marrow. It's the soft, spongy tissue located in the medullary cavity. Physis is a suffix that means growth. Related examples include epiphysis, metaphysis, and diaphysis. These are all parts of long bones. Cancellous bone, a type of bone tissue primarily in the interior of long bones. Compact bone is the dense, hard outer layer of bones that provides strength and protection. Calco and calcial mean calcium. Related examples include decalcification, the loss or removal of calcium and other minerals from bone or teeth. Hypocalcemia, not enough calcium in the blood. Poiesis, this suffix means formation. Hematopoiesis takes place in the bone marrow. Articulo and arthro mean joint. Related examples include articular cartilage, a strong, flexible connective tissue covering where bones meet to form a joint. It reduces friction. Articulate, to form a joint. In this image, the humerus articulates with the ulna and radius. Osteoarthritis. This type of arthritis is characterized by the breakdown of cartilage in the joints. Ligamento means ligament, a fibrous connective tissue that connect bones to bones. Tendo and teno means tendons, a fibrous connective tissue that attach muscles to bone or other body structures. Myo and myoso mean muscle. There are 3 types of major muscles: smooth, skeletal or striated, and cardiac. Leiomyo refers to smooth muscle found in organs and involuntary muscles. A leiomyoma is a fibroid tumor. Rhabdomyo is skeletal muscle found in muscles that can be controlled. Think all your arms and legs. If you have extremely sore or weak muscles a few days after exercising, you may have rhabdomyolysis. Myocardio is muscle that is exclusive to the heart. Myocarditis is inflammation of the heart muscle. Now that we've gotten through the vocab, let's get into the details of the musculoskeletal system. I told you before that bones are what hold us up, and without them, we would be just big old blobs. Bones act as levers, allowing movement through joints. They are made of calcium and phosphorus, acting as a calcium reservoir where calcium is stored and can be released into the bloodstream when needed. In the blood, the sensitive process of calcium homeostasis occurs. This helps the blood maintain a proper amount of calcium. The parathyroid gland secretes a hormone that lets bones know to release some calcium if there is not enough calcium in the blood. Healthy bones require a healthy diet, and vitamin D intake is an important part because it allows calcium to be readily absorbed by the bone and encourages the formation of osteoblasts. Without enough calcium in the diet, decalcification can occur. That decalcification can lead to osteoporosis and weak bones overall. Hypocalcemia should be managed under the care of a physician. It's usually treated with supplements and diet changes. On the other hand, hypercalcemia, a condition where the calcium level in the blood becomes too high, can cause problems as well. It can weaken bones and cause nephrolithiasis or kidney stones. Overall, a balanced diet is best. In utero, a fetus's bones are made of cartilage, but as the fetus gets closer to gestation, the cartilage hardens and becomes bone. Did you know that babies start with 300 bones? By the time they're 18 years old, they fuse into 206 bones. That's amazing! Osteoblasts are immature bone cells that build new bone tissue, replacing cartilage during ossification. Osteoclasts break down bone tissue to prevent excessive thickness and weight. These cells are important because if your bones kept growing and kept getting thicker, we'd be giants and weigh a ton. Osteoblasts and osteoclasts work together forever in this process called bone remodeling. Bone remodeling is crucial for maintaining bone strength, regulating calcium levels, and repairing injuries and micro damage. It's amazing that bones are alive. There are 5 types of bones: long bones, short bones, sesamoid bones, flat bones, and irregular bones. Long bones are elongated and cylindrical. They have broad ends and articulate with other bones. Do any come to mind? The femur, tibia, and radius. Short bones have a cubed-like shape, think carpals and tarsals. Sesamoid bones are round or oval, like the patella or kneecap. Flat bones have a flat and broadened surface. Think scapula, the cranial bones, or pelvic bones. Irregular bones. Well, they don't fit into any of the categories. 2 examples are the mandible and the coccyx. Let's take a look at the anatomy of a long bone. At the proximal and distal ends is articular cartilage. The articular cartilage is a slick cushion between connecting bones that reduces friction. It is made of fibrous tissue, and over time it can wear down. Worn-out cartilage is a bad thing. Think about it. Without articular cartilage, bones scrape against each other. This results in arthritis, ostealgia, and ultimately damage to the bones. Notice the proximal and distal epiphyses. These rounded ends primarily function as a support to joint formation by distributing stress. It is also the primary source of red bone marrow in long bones. This is where erythropoiesis, or formation of red blood cells, occurs. The epiphysis is made of 2 types of bone tissue, spongy bone and compact bone. Spongy bone is also known as cancellous bone or trabecular bone. It is light, porous bone tissue with a honeycomb-like structure and interconnecting plates called trabeculae. Compact bone, also known as cortical bone, is a dense, strong outer layer. It provides support, protection, and strength to bones, as opposed to spongy bone tissue, which contributes to weight reduction and shock absorption. Just inferior to the proximal epiphysis is the epiphyseal line, or epiphyseal plate if you're a child. Let me explain. The epiphyseal plate is a growth plate in the long bones of children and adolescents. It allows a bone to grow in length. During puberty, this plate gradually closes as the cartilage cells are replaced by bone tissue. This process is called ossification. Once the epiphyseal plate closes, the epiphyseal line forms and marks the end of bone growth. The line marks the point where the epiphysis, bone end, meets the diaphysis, bone shaft. Essentially, the growth plate becomes an epiphyseal line when growth is complete. Growth plate closure, also known as epiphyseal fusion, occurs around the end of puberty, with girls around ages 13 to 15 and boys are around 15 to 17. Whew, I hope that made sense. The middle of the bone is the diaphysis. The diaphysis and metaphysis are covered with the periosteum. This dense, irregular connective tissue has an outer fibrous layer and an inner cellular layer. It covers the entire bone except for joint surfaces. It provides attachment for tendons and ligaments, supplies blood vessels and nerves to the bone, protects the bone, and plays a role in bone growth and repair. Beneath the periosteum is compact bone, which is hard and dense, and if we look inside the medullary cavity, we see the endosteum. Like the periosteum, it is a lining of connective, protective tissue. It contains osteoblasts and osteoclasts and provides a surface for bone growth and repair. Yellow bone marrow is a type of tissue that serves as a reservoir for fat, which can be released into the bloodstream for energy during times of need. Yellow bone marrow also contains mesenchymal stem cells, which are amazing because they can differentiate into various cell types, including bone, cartilage, and fat. Osteoblasts and osteoclasts are the heroes when you break a bone. If you've ever broken your leg, you know the pain that comes along with it. You may have had numbness or inability to move or put weight on it. But what happens on the inside of your body? When a bone breaks, it's called a fracture. The healing process for bones happens in 3 stages. The first stage is the inflammatory stage, where the body responds to the injury site by forming a hematoma to stop the bleeding and stabilize the broken ends. The site swells and the body sends leukocytes to fight infection and osteoclasts to clean up debris. Later, osteoblasts arrive to start building a new bone. During the reparative stage, a soft callus forms from the hematoma. A few weeks later, the soft callus becomes hard callus. This hard callus is actually bone, but it's softer than regular bone. During the last stage, bone remodeling, the hard callus is gradually replaced by bone. Fractures can be simple or compound. Either way, the body jumps in right away to fix it. Here's an interesting fact: a bone can heal without callus formation. The doctor would just compress the bony fragments together so they could start the healing process. Let's move on to muscles. There are 3 types of muscles. We'll review them one at a time. Striated or skeletal muscles. These muscles connect to bones and help perform a wide range of voluntary movements and functions. Think of your arms, legs, and shoulders. They make up about 35% of our body mass. Skeletal muscle is made up of bundles of muscle fibers called fascicles. Each fascicle is surrounded by connective tissue called perimysium. The muscle fibers are cylindrical in shape and contain many myofibrils, which are responsible for muscle contraction. Smooth, visceral muscle are involuntary muscles found in the walls of internal organs, blood vessels, and other tissues. They're responsible for functions like digestion and blood pressure regulation and are not under conscious control. Visceral muscle is smooth when viewed under the microscope, hence the name. Cardiac muscle is exclusively in the heart. Cardiac muscle cells, also called cardiomyocytes, are branched and connected by specialized junctions called intercalated discs. These discs contain gap junctions, which allow for rapid electrical conduction. Okay, moving on to myomas. Myomas are tumors that originate in muscle cells. Leiomyomas, which occur in smooth muscles, typically the uterus, usually called fibroids, but can occur in other smooth muscles. Rhabdomyomas originate in striated muscle and are quite rare. They are most common in men over 40. I didn't forget about the heart. Do you know what a tumor in the heart is called? Like everything else in medical terminology, it goes by a few names: cardiac rhabdomyoma, cardiomyoma, and even a myxoma. Mix means mucus or slime. That's because this type of tumor is primarily composed of gelatinous connective tissue. What happens when you strain a muscle? When you strain a muscle, it means you've overstretched or torn the muscle fibers. The result? Pain, swelling, and loss of strength or range of motion. Think about a bungee cord. When you initially stretch it, it easily returns back to its original form, but over time it loses elasticity. Before you know it, you jerk on it too hard and it pops you because the fibers have pulled apart. Avoid muscle strain by paying attention to posture, conditioning your muscles, and doing appropriate stretching and warm-ups. Depending on the severity, a strained muscle could take weeks to heal and even need physical therapy. So take it easy. Movement requires the use of varying combinations of muscles, bones, tendons, and joints. The range of motion allowed by a joint is based on the shape of the articulating bones, the ligaments and tendons, and the surrounding muscles. Remember, tendons bind muscles to bones. Ligaments bind bones to bone. Here's a mnemonic to help you remember. Use your fingers to make two L's facing each other. Quickly turn the L's into B's that are facing each other. Now you can see that ligaments bind bones to bones. Another thing to remember, you sprain ligaments, but you strain muscles. To remember, I connect the first few letters to my favorite Italian dishes: spaghetti and linguine versus stromboli and mustaccioli. It's silly, I know, but trust me, it works. Muscles move by contracting and pulling on tendons attached to bones. This results in movement at joints. The origin is the attachment site of the muscle on the bone that remains relatively stationary during muscle contraction. It's typically considered proximal to the body. The insertion is the attachment site of the muscle on the bone that moves during muscle contraction. It's typically considered distal to the body. Muscles can only pull, not push. Joints are where two or more bones articulate. Our body has three main types of joints: fibrous joints that are immobile like sutures in the skull, cartilaginous joints which connect bone to cartilage and allow limited movement, such as vertebral joints and where the ribs meet the sternum. Finally, the special synovial joints. Bones in these joints have the protection of a joint capsule and synovial membrane. They're covered with articular cartilage and lubricated by synovial fluid, so they can move freely, as you can see in the diagram. Bursae also support movement of synovial joints. These small fluid-filled sacs act as cushions between bones, tendons, and muscles to reduce friction and allow smooth movement. They're found throughout the body, particularly around major joints like the shoulder, elbow, hip, and knee. Inflammation of a bursa is called bursitis. It can be quite painful. Types of synovial joints are hinge joints, joints that open and close in one direction, like knees and elbows. Ball and socket joints, where the rounded end of one bone fits into an indentation in another bone and rotates in almost any direction. Think shoulders and hips. Condyloid joints are made of two oval-shaped bones that fit together. They're similar to ball and socket joints, but they can't rotate 360 degrees. Your wrist is an example. An example of a pivot joint is your neck because it rotates in place without moving from its original position. There are also saddle and planar joints. You can read about both of them here. We just learned about all the ways synovial joints can move, so now let's talk about the motions they make. Here are the types of movements you need to know about: flexion and extension, bending and straightening a joint, such as at the knee or elbow. You can also flex and extend other body parts as shown in the images. Abduction and adduction, moving a limb away from or towards the midline of the body, respectively, such as at the hip or shoulder. Rotation, turning a bone around its axis, such as at the neck. Circumduction, moving a limb in a circular motion, such as at the shoulder or hip. Pronation is the movement that causes the palm to face downwards. Supination causes the palm to face upwards. In the foot, pronation is the inward rolling of the foot, and supination is the outward rolling. Here's some additional terms and pathology that will better help you understand this portion of the chapter. Atrophy, partial or complete wasting away of a part of the body evidenced by decrease in the size or function of a cell, organ or tissue. Amyotrophic, no muscle nourishment, which describes the process of muscle wasting away. Fasciotomy, cutting into the fascia, a layer of connective tissue surrounding muscles and other tissues to relieve pressure and improve blood flow. Fibromyalgia, a chronic condition characterized by widespread pain, fatigue, and other symptoms like sleep problems and mood disturbances. Muscular dystrophy, genetic disorder characterized by progressive muscle weakness and degeneration. Myalgia, muscle pain. Myasthenia, lack of muscle strength. Polymyositis, a disease that causes muscles to become irritated and inflamed. The muscles eventually start to break down and become weak. Sarcopenia, progressive loss of skeletal muscle mass, strength and function, primarily due to aging. Thanks for learning with me today. If you liked the pace and the content of this video, subscribe, like, and check out my other playlists, particularly part 2 of the musculoskeletal system, where we dive into the bones of the body.